Well, just carrying out a hymenography alone may not be sufficient. We have counselors, we have psychologists, we have psychiatrists, as well as we have surgeons and so on, other doctors now looking after these patients. Depending on the need, we can provide counseling, we can provide psychotherapy, specialized psychotherapy. We can also give them drug treatment if necessary, and we can obviously take a multidisciplinary approach to alleviating the suffering of the girls as well as the family. And at certain times the girls might harbor suicidal ideation, in which case we will treat it effectively so that the suicidality or the completed suicide can be prevented, and we can get her ready for a normal life. If you broadly speak, suicide cannot be prevented 100%, but in this particular situation, it is possible to prevent suicides, and we haven't had suicides in our hands, not at all so far. So, in psychiatry, as much as in any other specialty of medicine, the success cannot be guaranteed. So when you are trying to prevent suicide, sometimes there can be failures. But this multidisciplinary approach of not only repairing the hymen but also looking into the other needs, such as if there is mental illness, treatment of that, as well as supporting the family and enlisting the help required for the girl, it is actually possible to carry out an effective program of treatment and prevent suicides. Of course, we often get good feedbacks, and they are quite thankful to us for not only the surgery, of course, all the help that we have provided, and then they are quite happy to let us know that they now lead a quite happy family life. And if there was mental illness, obviously we have treated that, and they are quite well.